I pride myself on the culture of our program being one that's flexible. We really want to listen to what the fellow is interested in, and we want to push them to do things outside their comfort zone, but we also want them, to have a large say in how they structure the year and making sure we provide a wide variety of opportunities for that. So I want it to be flexible. I want it to be supportive, and it is supportive. I mean, I have a very close working relationship with the fellow at least once a week for supervision, and when they're on my clinical service, on the inpatient consult service, I meet with them more regularly to go over patient care. But I want them to feel supported in clinical work. They know that somebody always has their back. They know that I'm going to support their career interests. I'm going to help connect them to people around the country that I know through the Academy of Consultation-Liaison Psychiatry and get them jobs, make sure that they're well connected for scholarly activity, that it's supportive, that they feel like I care about their wellness. And I do. I really care about the wellness of my fellows. I think it's also, an exciting environment. It's fast-paced at times, but I think it still balances wellness. The fellow doesn't have call, they don't have nights or weekends that they have to work. So they have a lot of time for themselves and to prep themselves for their general boards or for their career. But, I want it to be supportive of their needs. And I want it to be, exciting and fast-paced, and they really learn a lot, I think, while they're here because of that fast-paced, innovative, exciting environment at the University of Michigan and the Ann Arbor VA provide. I also say that the culture is one that's attuned to issues of diversity, equity, and inclusion. So the fellow has opportunities to participate in a variety of activities through the department and through the health system at large. There is, House officers have the opportunity to participate in the Health Equity Scholars Program if they wish, which is like an additional training, and it's a several-week course put on by graduate medical education on issues related to health equity, and the fellow would then undertake a scholarly project through that year. If they don't want to be that formally involved, they can be involved in activities of diversity, equity, and inclusion through the Department of Psychiatry. And there's volunteer opportunities, there's book clubs, there's movie reviews and documentary reviews. Another innovative thing that's part of the culture of diversity, equity, inclusion is the Health Equity Consult Service. So that's a separate consult service that is offered to patients admitted to University of Michigan Hospital. And our fellow has had the opportunity recently to rotate on that service and really got a lot out of understanding more about what some of the issues are related to equity and concerns about health equity in a variety of forms. And so I think that culture of equity and inclusion is very important to our department, to our health system, and to my program in general. And that's something that I'm really proud of.